This is against their collective bargaining agreement, where it was agreed that all doctors are entitled to a comprehensive health insurance scheme, preferably the National Insurance Fund, that is the NHIF, as per the collective bargaining agreement signed and registered in court. Now, all doctors are entitled to a comprehensive medical cover. Let's now speak with Dr. Thuranira Kaugiria, who is the KMPDU Nairobi branch secretary. Good afternoon, Doc. Thank you for joining us on News Desk. Is the strike still on?
Thank you. Thank you so much, Grace, and thank you for having me at 1. The strike is still on at midnight. A minute after midnight, our strike starts. Yes, the strike is still on.
Okay. Now, I know we've raised some of the issues that you people have, but talk to us about what these grievances are.
So essentially, we have been through this for quite a long time, from the days of Nairobi City County Government and the advent of Nairobi Metropolitan Services. We have been having frequent meetings every month since they came into being, and we have had several grievances. It's unfortunate that during the COVID-19 pandemic, healthcare workers, especially doctors, have not had a comprehensive medical cover. So essentially, when you become sick, you have to go pay cash, or we have to contribute for you, get some money from the union kitty to pay for your medical bill. Essentially, doctors are giving services they cannot afford. That is one of the grievances. So we have not had a comprehensive medical cover to take care of the doctors working Nairobi City County Government for the last 2 months, since 1st of July. The second issue that we have is that we have had 5 specialists working at the Mama Lucy Kibaki Hospital who have been working there day in, day out for the last 26 months. These 2 years, 2 months. The problem has been there has been issues with the County Public Service Board. So they kept on being given promises of they will be paid, they'll be paid, they'll be paid. So we're wondering how they have been surviving. So it's a number 2 demand that we need to get. Number 3 is that we have doctors, very senior doctors who have stagnated in very lower job groups. And it's unfortunate that our bare minimum is that all those doctors must be promoted, designated, and given their promotion letters before you call off the strike. The last thing and the most important thing is that you remember that when His Excellency the President came up with all the directives, gave a directive about healthcare workers getting a care package, and part of the care package is getting healthcare workers somewhere they can be admitted, where they can be treated. It's unfortunate that what the county government has offered us is a hotel that is substandard for doctors to be admitted there. So we are forced to go recuperate in our homes. If you become severely sick, you go be admitted in a general ward, be admitted with other patients, be admitted either in a private hospital, and at the end of it all, you have to pay the bill. So we want them to provide a care package for us who have been taking care and have been handling these issues of this pandemic throughout. Now, lastly, is we have had several issues. We have had many discussions with them. It's unfortunate that we gave them a 7-day strike notice last week on Friday. At a time like this, we were issuing the strike notice. It's unfortunate that they have just invited us for a meeting this afternoon at 3 p.m. They have sent an invite via WhatsApp message. So it's just showing disrespect and lack of commitment in sorting out these issues. We shall attend that meeting notwithstanding. We have all the hope that they'll try and avert the strike. We really hope that they will come with concrete, they will come and table the NHIF medical cover, a signed MOU between NHIF and Nairobi Metropolitan Service. We hope that they will present with us 112 consultants, specialists, promotion letters, and a letter to payroll to actualize that. We expect them to provide with us a facility whereby healthcare workers and their families will be admitted. We expect them, much more importantly, that the 5 medical specialists who have been working have been taken back to payroll and their arrears paid. Failure to which we shall continue our strike. Our strike starts at midnight today. The clock of midnight, we exit our workplaces, we go home. We'll be following the Ministry of Health directives, which are stay home, keep safe, wear your mask, social distance. So we'll social distance from the health facilities, we'll social distance from our workplaces until a time when they have sorted out all our grievances. These grievances are very easy to sort out. These are grievances we have been discussing since March. We have been discussing since last year. I tend to think signing an MOU between NHIF and Metropolitan is an easy thing. Issuing 112 letters from Public Service Commission is a simple thing. So that's all that we are asking for, and that's what you are ready for. Thank you, Grace.
Okay, Doc, before I let you go, you've talked to us about, they've asked you guys to meet them at 3 p.m. today. But I'm curious because one of the people in this administration, NMS, Nairobi Metropolitan Services, is your former SG, Dr. Ouma Oluga, who is now the Chief Officer of Health at the NMS. Talk to us about that, because one would think that him being your former SG, things would be better for the KMPDU Nairobi chapter.
That's a very good question, and I expected you to ask it. Dr. Omo Luga is a very good friend of mine. We have been friends since when we were undergraduate students. We were in the union together. We fought together. He was jailed while we were fighting the struggles. Now he finds himself in the opposite side of the divide, and now he has to hold brief for government. It's unfortunate that the mandate that you have been given by doctors is to fight for the doctors. We will fight for the doctors against our friends. Even the government, the people appointed in those positions are very good friends. But when it comes to fighting for our rights, we do not care who's on the other side. So we'll be meeting with Omo Oluga this afternoon. It will be a very cordial meeting. But it's unfortunate once we disagree, we have disagreed. So we are looking forward to how that meeting will be.
Okay. Lastly, Doc, just talk to us about what exactly is the problem in the health sector. I'm asking this because apart from you guys, the Nairobi chapter, we have the people, the health workers from Homa Bay who have also issued a strike notice. This afternoon, actually, we also had clinical officers, and this is coming at a time where we are fighting a pandemic, COVID-19. What exactly is the issue? Apart from the issues that you've raised, of course, what is the problem?
It's unfortunate that we have county governments specifically who do not see the priority of sorting out the issues of healthcare workers. It's very unfortunate that we have county governments that have not paid salaries. It's really painful to hear doctors in Homa Bay County have not been paid 2 months' salaries. And it's not that that money has not been allocated. That money had already been allocated. That money has been given to the state counties. There are issues about promotions that have been pending. There are issues about medical cover. And as we have been championing as a union and will continue to champion, is that the panacea to this problem is a Health Services Commission. A Health Services Commission will be a neutral employer who will do the same thing across the board. So the Health Services Commission that is espoused in the BBI, the Building Bridges initiative that will be put to a referendum. Us as doctors, we are saying there is no BBI without HSC, and HSC must be in BBI. We want to sort out this problem. We can't be having strikes day in, day out. It's unfortunate that there's a looming country doctor strike. If these things continue like this, currently there are over 7 counties that have issued strike notices. Homa Bay are currently on strike. There are issues in Nakuru County. There are issues in Embu County, and it's unfortunate that if we continue like this, it seems like we are preparing for a nationwide strike. We have done it before. We have done it for 100 days. We have been jailed. We were out, and we continue to be. We are ready to do an episode 2. Actually, we are preparing for it. Let them sort out these issues urgently. They are not very serious. You cannot be issued with a 7-day strike notice, and on the last day is when you want to sort out the issue. So there are very sticky issues that concern the healthcare workers, nurses, clinical officers, doctors at it, and we would want them to be sorted out also. We want to put the ball at the foot of His Excellency, the President of the Republic of Kenya. He means well for us, means well for the country, means well for the healthcare workers. He knows what we did to sort out our previous strike. He needs to come and intervene. His other junior employees have all failed. Let's give him a chance to come and intervene and sort it out.
Indeed.
Thank you.
Thank you. Thank you so much, Dr. Thuranira Kaugiria, the KMPDU Nairobi Branch Secretary, of course, talking to us about